Give us a smile, America. CDC and Healthy People 2020 Goals for the Future, Part 2. Healthy Teeth for All. The CDC, in coalition with programs called Healthy People 2020, have created initiatives to educate on oral health care and prevent oral disease and decay. Like the CDC programs, Healthy People 2020 are set out to help educate and prevent oral disease and conditions. Among their goals is preventing dental caries, periodontal disease, preventing oral cancers, and educating about other craniofacial conditions like cleft lip and cleft palate. With eliminating disparities, they can continue to further these goals. Eliminating disparities. Beyond the lack of oral health education stands the lack of access for good oral health care. These disparities can include income, race, ethnicity, education, age, and gender, and even geographic regions of the U.S. One goal of the CDC is to help eliminate these disparities. What's the plan? With the lack of preventative care and education for certain parts of the country, many individuals suffer from oral health conditions and diseases. Part of this goal is monitoring where preventative services and education is needed, providing information to communities, health and education providers, and dental providers, and even invoking the assistance of policymakers to help reduce these disparities. So how is it done? By reaching these goals, both the CDC and Healthy People 2020 programs can increase oral health education in low-income families and schools, increase the amount of low-income children and adults who utilize preventative dental services, and reach more individuals at the early stages of good oral health care. Good oral health care for all. No person should ever have to go without good oral health care and education. Although the CDC has stated that oral health diseases have decreased in the U.S., it is still an issue that those without education or access to oral health care are still those that suffer the most from dental diseases and conditions. Continuing the process of furthering school programs, community education, and access to oral health programs, more individuals across the country can increase their overall oral health and overall health.